Aloha mai kako. My name is Lisa Leilani Ka'anoi. I'm from the Healthcare Workforce Development Center, known as Mauli Ola Ma Lama Lama at Papaola Lokahi, the Native Hawaiian Board of Health. Mahalo for joining us, and mahalo for those who will be joining us by the recording. So just if you didn't hear the announcement, this is being recorded, and the recording will be shared for everyone that has registered. So if in the future, if there's a webinar you'd like to see and you're unable to make it, as long as you register, you will be able to receive the recording. Sorry if you can hear the chickens in the background, they want to be part of this. So for questions or comments, please feel free to use the Q&A feature or the chat feature that is located in your Zoom toolbar at the bottom of your screen. If this is the first time you're joining us, you will be automatically added to our email list for future presentations. And then last at the end, there will be a survey that pops up. If you have the time, it'd be great if you could fill that out. And if not, it is Friday, and if you have to run, A'oli Pilikia, we'll send out a follow-up email on Monday, again, to see if we can get some of your feedback or mana'o. All right. So I'll go ahead and introduce our guest speaker today. So Leilani Maxera, she uses the pronouns she or they. She is a licensed clinical social worker. She is a daughter of the Hawaiian diaspora raised in Martinez, California by Karkines and in the shadow of Mount Diablo. She grew up in the homeland of Karkin and Muwekma Ohlone tribes and was called home to Hawaii in her early 30s. She currently lives in Manoa Valley by the Manoa Stream at the base of Pu'upia of the Ko'olau Range. Leilani is a therapist with her own private practice, Ka'ipu'o Ka'ua Loku Therapy, plus death work, plus consulting at ka'ipu'okaualoku.com. She is a death educator and grief worker and the founder of Death Cafe Honolulu. Leilani worked and volunteered in harm reduction for 14 years, including managing a syringe exchange and an overdose prevention program where she conducted training and education with other social service organizations to teach about overdose prevention and response and to reduce stigma around drug use. And I will now turn it over to you, Leilani.
Mahalo, Lisa. Thank you so much for having me today. And also thank you so much to everybody who came. I know it's Friday afternoon. You have so many choices of what to do with your time on a Friday afternoon. So I appreciate you coming to share this space with us. I'm going to go ahead and share my screen, which it looks like it's not letting me. Hold on one second. Huh.
Don't just hit the green box with the arrow up. Don't hit.
Okay. Okay, I did, but hold on one sec. For some reason, my PowerPoint's not coming up. Can you all see the PowerPoint now? Lisa, can you see it? I wonder why. Oh, it's saying that I can't share screen.
Here, let me try again.
Okay. All right. Thank you. I appreciate it. So while we're waiting to figure that out, again, thank you everyone for coming. And also, I'll just want to take this time I like to be transparent about sensitive topics. So just saying now that this is a presentation where I'm going to talk like very openly and honestly about death. And we'll also be mentioning some deaths that are violent. So if these topics make you uncomfortable, please do what you need to take care of yourself and make a decision about your participation based on that. But I like to be transparent and give people choice.
We can see it now.
Oh, wonderful. Thank you so much for letting me know. Okay, well, again, thank you so much, everybody. Welcome, and thanks for coming to our talk today. We'll have plenty of time at the end for questions. So if you put them in the chat, I may not see it, but we'll definitely get to it at the end when we have more time. So first of all, the name of this presentation I kuana'u. This Olelo Noiau speaks to me very clearly, so I chose it for the name of the presentation today. It means more literally a burden for me, but more figuratively, let me carry your burden. As someone who is a therapist and a death doula, this is what I offer to you all and our community. This is what I see as my kuleana. And it's also a sentiment that helped me name my private practice, which is Ka'ipu o Ka'ualoku, the ipu, or the vessel for the torrential rain, which obviously more figuratively means not torrential rain, but the heavy emotions that people carry, asking to be the vessel for that as a therapist and death doula. These are my two cats. I figured I'd share a picture of them instead of just another picture of me, because you're kind of seeing me on screen. You don't need that. But those are my two cats who are actually sitting behind me sleeping, and I'm kind of worried they're going to wake up and start terrorizing me while I'm talking. So I'm hoping not for that to happen. But their names are Jet Jaguar and Chucky Biscuits, and they're siblings and 1.5 years. And I figured I'd share them instead of something else to get your daily dose of cuteness at the end of your day on a Friday. But they're my buddies. And like I said, I really hope they don't wake up and terrorize me, which they can do sometimes. So mahalo to Lisa for sharing my bio. Just to elaborate a little bit for some more context that will be important later when I talk about how I became a death doula. I was born and raised on the continent, and since I was 19 years old, I knew I wanted to live in Hawaii. I had never lived here. My mother was born here and moved to California. I knew I wanted to come home to where my family was from, but it actually took until I was 33 to have enough money to do it. So it turned into a pretty long-term goal to get back here. And in case you're wondering, I'm 41 now. So it's about 7.5 years that I have been home on Oahu. And this will come up later when I'm talking about how I became a death doula, but to note that I did not grow up around extended family. I know like 5 people I'm related to on the Hawaiian side of my family, and I was raised in a very small, mostly white town with not much community, which I know is pretty different than a lot of folks who grew up here on the islands. But that piece is very integral to my journey and my story about how I became a death doula. And I've been on my death work journey for about 16 years now, when my experience with the death of my maternal grandmother absolutely devastated me. I did not know what to do with my anger when she died. And it kind of set me on this journey to understand death and help other people. And as mentioned, I am a death doula. So what is a death doula is, I guess, the big question, right? So a death doula is a person who provides support for individuals facing serious and/or terminal illnesses, and also for those who love and care for them. So that means they serve not just the individual who is dying, but also they serve the loved ones who surround that person. And despite the name, death doulas also serve people who are not ill and are not currently dying. In times of wellness, death doulas can also be utilized to help with things like pre-planning, facing fear of death, things like that can happen before death. And then death doulas can also serve loved ones of someone who've died after death for ceremony, grief work, etc. And maybe you've heard the term death doula, and maybe you haven't, and you've heard other terms that death doulas sometimes use to refer to themselves, things like end-of-life doula, death midwife, soul midwife, death worker, full spectrum doula, which means that somebody works with folks who are dying, but also does birth work as well, death companions, and more. There's so many other names people use. But death doula has become more popular and more, talked about in the news, more stories about death doula's work. So usually I use death and grief worker, but death doula is becoming a little bit more, easy to use with folks because they've heard of it. And death duels are a part of, or they're just one piece of what I would call community death care or community care work, which I'm going to explain more about after this slide. Some of this care work might sound familiar to you, and other things that this might be the first time you've actually heard about. But I guarantee that without you even knowing it, that you have absolutely participated in community death care on some level. So what does community death care and death work entail? So healthcare is one big part of it. That can look like helping people get to their doctor's appointments, helping people navigate the transition to palliative or hospice care if they choose to do that, or even filling out an advanced healthcare directive. Those are just some examples, but there's plenty of things that have to do with healthcare that is considered community death care. Body care is another element of it, and this can occur both before and after death. So for some examples of before death, if someone isn't able to bathe themselves, helping do that for them. And other things in this realm can be something as simple as brushing somebody's hair, rubbing lotion on their tired feet. Also things like doing their makeup for them if their eyesight or maybe their strength to raise their arms no longer permits, but they'd still like that to be a part of their routine. And after death care can include things like washing someone's body and preparing it for ritual or viewing, or even as a way to have close intimacy before saying goodbye to that person. I actually wrote my social work thesis when I graduated with my master's of social work on grief and home funerals. And there's unfortunately not enough research out there about this, but one thing I found is that what little research does exist shows that people who have died, when their loved ones have access to their body and time to spend with their body, it actually helps process that the person has died and process saying goodbye more than if a body is taken away immediately. So there are some people who that might not be the case for, but the majority of people it has shown benefits for to care for a loved one's body or even just spend time with it after death. There's also a national project, if you haven't heard of it, or international, actually they're in Canada too, called One Washcloth. And it helps encourage loved ones to take the time to even just wipe down someone's face or hands as they're dying or after death, just to show some intimacy and be healing for the person who was left behind. The everyday is part of care work. So this is probably where you most likely as an individual have participated in community death care and maybe not even realized it. Because this is just even something as simple as picking somebody's kids up from school or watching them while they deal with the logistics of funerals or healthcare stuff, dropping off dinner for the family after someone has died, letting them know you're going to the grocery store and asking if they need anything, which, just to add, that's like often really appreciated. One of the things that happens when people are seriously ill, dying, families are very stressed, we often will say, oh, let me know if you need anything. It's very common to have that reaction. And the reality is, in situations like that, sometimes people are so overwhelmed that they actually don't know what they need. They don't know what the answer is. And so offering something very concrete, if you're able and you know them well enough, can often be incredibly helpful. Like, hey, I'm picking my kid up, near yours tomorrow anyway. Let me just pick up your kid for you from school. You don't have to drive. Let me drop off food. You seem overwhelmed. Specific things can be so helpful to families. Even just, walking someone's dog, right? Like anything you could do. And there's a lot more to add to this. We could just talk about this forever, but hopefully you get the picture that community care work encompasses everyday tasks of life that people need to keep going, that people need to live their daily lives. For finances, this can look like helping people get a will in order, or maybe helping people set up a trust for their children. And also just helping people out financially when they need it. Medical and funeral costs are prohibitively expensive for people, which should not be the case, right? Anything that we need as humans should be free, truly. So funerals, healthcare should absolutely be free. And we shouldn't have to be relying on GoFundMes for these things that should be easily accessible to us. But truly, at the moment, unfortunately, it's our current reality. So even just monetary contributions, or not even just, it's a big deal. Monetary contributions are part of how we care for each other when people are ill and dying. Disposition, arranging for the funeral, burial, or cremation, helping with logistics for an open viewing or a home-based funeral can also be a part of this. Also, FYI, home funerals are legal, which is another topic to do a presentation on. But yes, under some circumstances, you absolutely can keep your loved one at home for a few days for a wake and a home-based funeral. Ritual. Oh, sorry, grief care. Grief work is also community care. Just listening to people that are in grief when they are helps tremendously. And listening is the key word there. One piece of advice I'd give is don't talk more than they are in trying to comfort them. A lot of times we want to say the right things and we struggle and we want to fill the silence when people are having a hard time. But, really people usually just need to know that somebody's hearing them and witnessing their pain and being there. And sometimes people need professional grief counseling, whether it's short term for just a few sessions or a longer term therapy or long-term grief sessions if they're having a really hard time adjusting to the death of their loved one. Ritual is a part of community death care, and it's very important for healing. And ritual can also be grief work. People can plan all types of rituals to help remember loved ones, to honor them, and sometimes it can help in letting them go. Ritual can be something personal and done all on your own, something you could do without other people, or with the assistance of someone else, or in a group activity. Ritual includes funerals, wakes, church services, bringing flowers to someone's grave, even just writing somebody a letter of all the things you wish you could tell them after they're gone, and burning it or burying it. Ritual can look lots of different ways. And also, with grief and ritual, sometimes, unfortunately, people die suddenly and we don't have this time to prepare or, mend strife and bridges with a loved one. But even ritual that can come up in preparing for death, like ho'oponopono, can be a part of grief and ritual also. If you have time with your loved one and your family needs something like that to start the healing process. And then finally, legacy work. And you can get really creative with this. Legacy work can look like many different things. And it can really help, to heal, but also help leave someone behind. And it could be done before or after someone dies. So for example, before death, maybe you are terminally ill, but you are the carrier of all the best recipes in your family. You could write them down in a book to be shared. You can even film yourself making them to teach folks who are not alive of future generations. You might have specific stories you want to tell to make sure they get passed down. And there's many different creative ways to do that. You might want to set up a scholarship fund or a trust for your loved one. All of this is very personal. Legacy work especially, there's so many different things out there. And just to give a really specific example, my grandfather, Alexander Jarrett was his name, and he was one of the founders of the Seamen's Home on Alakea Street. It's now called the Sailor's Home. They changed the name. I don't think people liked saying Seaman's home for whatever reason. But years ago, I first visited, and this was like 13, 14 years ago. And the people who worked there, they still knew his story. Even though he had died before I was born, I never met him. The people who had passed on their jobs to the current people who worked in the office there, they knew his story, they knew who he was. And there was this huge portrait of him, or it was this photo just huge in the office there. And they told me stories they'd heard about him, but everyone still knew who he was. But 10 years later, I went to go visit again, and none of the people worked there anymore. Everyone had retired. And I wanted to show my mom the office because she'd never been. And they had not passed down who he was. So I, when I asked, like, okay, we came to visit my grandfather's picture and like look up the newspaper articles he'd written for the union. And they're like, oh, thank goodness somebody came and knew who this was. We have no idea who this is. We were going to take the picture down. And so for a legacy project, my mom and I ended up researching the speech he gave at the opening of the home and making a plaque out of part of it. So that would be up, and folks would remember who he was if ever the people who worked there, moved on and didn't know anymore. So that's what community care work is. And so now, since you know what that entails, when and why would you want to call on a death doula to be a part of your community death care? You may have been listening to this and thinking, all these things you mentioned, these are things my ohana already do in times of need, or my neighbors, my friends I grew up with, or maybe even, in your family, you have an auntie that is like the expert on all of these things. She's who everyone turns to when someone is sick or dying. And if you're someone who's thinking any of that, amazing. I'm very happy for you. That is fantastic that you have such close community that you feel like you can share these things with. But not everybody does. Not everybody has someone they can call on for kukua in times of need. And not everybody actually has family. And also not everyone lives near their families. So they could be, across the world, across the ocean, and they're not around the people that they would call on in times of need. So there's, a wide variety of reasons why someone might not have people to support them. But whether you're in either of those categories or somewhere in between, death doulas can help on many different levels. So even if you have a big community, you might need someone to teach you how to care for your loved one's body before you have them lie in wake. That might not be something and you want someone to show you. You might want someone to walk you through filling out paperwork. Maybe talking to your loved one about legacy planning is too emotional for you. Maybe you know what you want to do with your loved one as a legacy project, but you get too emotional, it hurts too much. You need to bring someone else in to be the voice and to be the planner. And death doulas they can play many different roles. They can walk you fully through a serious illness and into death, or they can be counted on for just specific things. And while most death doulas can support you across the spectrum of your needs, some also have very specific specialties that you may choose to seek out for your loved one. So for example, one of my death doula friends in Denver is a celebrant. So she does all, the whole spectrum of death doula work, but she really is good and specializes in creating unique ceremonies for grief. Very good with ceremony. And then also, for example, here on Oahu, there's actually a death doula named Joy Rodriguez, who I do work with. And she has very special training to work with people who have chosen medical aid in dying at the end of life. including having been trained to mix the medications that people take. And that's something I myself do not know how to do. I've never been trained how to do that. So, you know, that's another specific thing. Like if you have a loved one who was choosing the route of medical aid in dying, you know, it's a death doula exists that's their specialty, and they may be the person you want to call on for that. So if you do decide to seek out a death doula, make sure that the person and what they offer is a good match for you and what you need. And it's also a good match for your loved ones. And I always, you know, what I would say about looking into it or trying to find somebody is trust your gut. Just like seeking out a doctor, a babysitter, or any other type of helper that is going to work with your family. Not just anyone is going to be the right fit for you. You may want someone who understands well your religious practices. That might be something really important to you. So you want to seek out someone who absolutely understands the ritual and the rules and everything around death in your religion. Someone who is available the very specific hours you need them. Maybe everyone in your family works all day, so you need somebody you can meet with at 9 o'clock at night that'll always be around. Something as specific as that. Or even something really specific, like a death doula who gets your auntie's very morbid sense of humor and can handle all the constant jokes about dying. That is not everybody, right? So you got to find the right fit for you and your loved ones. You got to just make sure you find the right person for you. And also, if it turns out that they aren't, end your time with them like any other professional. You are not stuck with people just because you ask them to do this work for you. If they, like any other professional, if they're not a right fit, it is okay to tell them goodbye, because you definitely deserve the care you want, the care you need. And I will be very blunt. There are death doulas I know both here in Hawaii and on the continent that I would absolutely not recommend working with. The number one reason for all of those people being lack of humility, both cultural and otherwise. So being a death doula is like any other profession. There are plenty of people who are good at it, but not everybody is. And one thing also about cost. So just to talk a little bit about what the cost is for such services. Some death doulas have really strictly set prices. Some are sliding scale based on the base being on need and income, and some do offerings for free when can. I don't personally fault doulas who need to be strict about their pricing, as it is a job like any other job, and our time is worthy. I myself do offer sliding scale for different services, and some I offer for free. For example, I am a licensed clinical social worker, and because of that, I am legally allowed to do the mental health evaluations for patients in Hawaii who seek medical aid in dying. If you didn't know this, we are the only state that requires mental health evaluation as part of accessing medical aid in dying, to make sure people understand what they're asking for. And so because I'm licensed, I am able to do that for folks who need it, and I don't charge. To me, like, it should be absolutely easily accessible to anyone who wants it. I do it via telehealth for any people on any island. Don't ask for insurance, don't charge. To me, it's something that I feel like I could never charge for. Also, something like advanced healthcare directives. I think everybody should have one. So I volunteer helping people fill them out. If you don't know about Kukua Mau, they're fantastic. And they're kind of the home for our advanced healthcare directive information in Hawaii. I volunteer with them. So those are just two examples of things I do for free because I feel like those things should be free. But everybody's different. And there's really like no shame in money being a factor when you choose a doula for their services. If you need to see somebody who, and pay the minimum, that's okay. The folks who offer sliding scale wouldn't if they didn't want to. But I do say, if you can afford to pay the normal fees, I do encourage you because to do it in fairness to the people who do this work. Also, just a FYI, some of the hospices here are getting on board with death doulas as part of their care teams. So if your loved one is looking at hospice at any point, that might be something to ask about if you're interested. So I don't know off the top of my head how many hospices are doing it, but offering it as part of their care team with nursing, social work, etc. And that's pretty cool. I'm glad to see that is spreading here in Hawaii. And just another note about death doulas before I move on to the next slide is training. So to let you know, there is no certification for being a death doula. It does not exist. So if you're talking to someone who's a death doula and they tell you they're a certified death doula, run. It doesn't exist. But people will say that they're certified because it sounds official. It sounds like they sound important. And so, but it's not true. Because there's many different classes and trainings people can take. People can volunteer in hospice and learn on the job. Maybe this knowledge was passed on to you. As a chosen person in your generation of your ohana, maybe you've been chosen to be the keeper of how to take care of the dying. And so, there's many different paths to this work. There's many different ways to get here. And I really think that people who gatekeep death work, there are just pilau. Like to me, it's, not a okay thing to be doing. And as Hawaiians, we all know that all knowledge is not taught in the same school, right? So there's different ways to get there. There's different ways to be doing this work and to learn it. So how did I become a death doula? I talked a little earlier, kind of set the stage for my story, but I wanted to share it at the end. I definitely wanted to share my story so that folks kind of know where I'm coming from and doing this work and what led me here. But also I saved it for the end so it wouldn't be all you were thinking about me for the whole training. But when I was younger, I never had experienced a serious illness in my family until I was about 23. So I had experienced death, several deaths in family, friends prior to being 23. But those deaths were all sudden deaths, like car accidents, homicide. No one close to me had ever had a prolonged illness. And it's not something that was ever talked about in the home, nothing I was prepared for. And like health class, when you're in primary school's a joke, right? They're just like, don't smoke or drink alcohol and don't have sex and exercise, right? Like most of those health classes, that we take when we're younger, they don't tell us the real stuff we need to survive and be present in the real world. They truly should cover illness, serious illness, what happens when people get sick when you're a kid, so that you are more prepared. Because if your family talks about that sort of thing, then you're golden, right? Like you're like, oh, this is what's happening. But for me and my family, illness was never mentioned. We had never talked about what to do if someone got sick. And so at 23, my maternal grandmother developed cancer and dementia, and she was in major decline for a few years. It took about 2 years for it to get really bad. So remember when I mentioned at the beginning that I did not grow up with community. I did not grow up with a lot of people. So the only people who were in her life at the time, no other relatives or friends, was just me, my mother, and my aunt, my mother's sister, just us three. And we also, unfortunately, had to keep our jobs at the same time because we were both, all three of us were too poor to quit working to take care of her. So we kind of rotated. And a friend of my mom's best friend, helped out too, but we really couldn't depend on anyone else. My brother was really deep into his drug use. So he was too ashamed to come around and visit her. And as a consequence, didn't see her before she died. My uncle, my aunt's husband, died of a drug overdose while my grandmother was dying. And my stepdad had really severe mental health issues while she was dying, and ended up completing suicide right when she died, right after she died. So we truly were stressed to the maximum, no hope, no help. And in all of her visits to the ER and the ICU, which were many, because we did not know what to do, we ended up taking her to the hospital way too much. We were never told about palliative care or hospice. We had no idea that there was help for caregivers, just nothing. When you're a caretaker just trying to get through the day, you don't really have time to do the research. Like I would be exhausted, go to work, take the train to see my grandma, take care of her for the weekend, go back to work on Monday. And also, not only were we exhausted, burnt out, at this time, I know it's hard to imagine now, but none of us had the internet. None of us owned a computer. None of us had smartphones. So truly did not know what resources were available at the time, and nothing was offered. So we were completely adrift. When my grandma died, I had a lot of anger and a lot of regret in me. I was super depressed for a long time, to be honest. And to get out of that depression, I became obsessed with learning everything I could about aging, illness, death, anything related to it. And I learned about advanced healthcare directives, and I absolutely hated the hospital for never having offered us information on them before her dementia got so bad that she was unable to make these decisions herself. So I was pretty angry at the world, but I turned that anger into something. Had I known death doulas existed, had I known hospice existed, palliative care, it would have helped us immensely. And because of that experience, I've spent the last 16 years educating myself and trying to be that resource for other people, because I don't want anyone else to suffer like I did and like my family did. I try to do now what I needed from other people all those years ago, and to educate other people that these things exist, and to help support people in their dying. So yeah, so that's my story. That's why I waited till the end, so I wouldn't color the rest of it. But I hope I've made clear and understandable that what community care is, what death doulas do, and why I'm a part of this work. And I talked faster than I meant to, so we have a bit of time. But I just want to say that, there's time for questions now, but also if you want to contact me because you feel more comfortable asking a question in private, that's absolutely fine too. I'm happy to spend time with any of you to talk through this stuff, to answer questions. I really just want to be a resource for others who have questions about death and dying and community work. And I'm happy to answer anything. Thank you.
So we did have a question. I don't know if you saw that about the certification, Inelda.
Oh, Inelda, yeah. So Inelda is the International End of Life Doula Association or network. I can't remember exactly what the acronym stands for. Yeah, they're a big organization. They are member-based. They do tons of different types of trainings. They offer classes, they offer support. They are not certification. So like if you take a class, what someone can offer you is a certificate that you took a training, a certificate like just like any other training you take, like CEUs or something. And it can mean something for sure. I mean, Inelda is a respected organization if you took it from them, but there's also like literally dozens of other organizations that teach death doula trainings. So they're one of the biggest, but if they use the terms, you're a certified death doula, it's not real. There's no laws around being certified as a death doula. And, you know, to be honest, I'm someone who really is against that, because it, you know, it turns into the commodification of like folk information, of like cultural information. You know, as I mentioned before, for a lot of families, that's someone's role that's been passed down to them. They're, you know, they've learned how to take care of the ill people in their family from another loved one, from an auntie, and, you know, people regulating who can do death work does not sit well with me whatsoever. So that's why I said, when people say they're certified, like, or they're a certified death doula, it's like, it's not a real thing, but people like to use the word because it sounds, you know, professional, right? So
Interesting. Mahalo for that. And then also there's a question about, can you please go into detail more about a home health funeral?
A home funeral, yeah, that's what I was saying. That could be a real long presentation, but the very short of it I'll give is that so I'm on the board. I didn't put everything I do in my bio because it'd be obnoxious and long, but I'm on the board of the National Home Funeral Alliance. If you haven't heard of it, it's a organization. It's one of the largest organizations in the world that offers education on home-based funerals. And so basically what that means is exactly what it sounds like. Community-based funeral is that it is legal in every state on some level. But every state law is different, to take your loved one's body home for, usually depends on the state, up to 3 to 5 days for a home-based funeral. And so in some cultures, in some places, that's just what a normal funeral. Like I mentioned, I wrote my thesis for my master's of social work on home funerals, and I interviewed somebody whose family's in the Philippines, and that's just a normal funeral where they come from. They grew up in a small town. They went home for their grandfather's funeral. He laid in wake in the living room. People took turns sleeping with his body, taking care of him, washing his body, changing the ice, etc. So a lot of folks, when, you know, times we say home-based funeral, it's for some people, it's still the norm in their culture, number one. And number two, it's how funerals were done in the United States up until the Civil War. So really quickly, the Civil War is what kind of changed the history of how we have funerals, because it's the first time that people died on the continent far from home. Most times people died close to home. Like even here in Hawaii, it wasn't until our elite started traveling to, you know, and to, you know, do diplomatic work in other countries, and people started traveling for trade. People died close to home. So you were with your loved ones and just had the funeral there with them. You didn't need a professional involved. So that's kind of like what a home funeral is. It is legal in Hawaii, but unfortunately here, under very specific circumstances, it's harder to have a home funeral when there's like an open investigation around the death. If you don't have someone to sign off on the death certificate, I don't want to get too far into it, because it's you know, that I could talk for another half hour explaining the, like, how it goes here, but it's a great question. And there's, I encourage you to look up National Home Funeral Alliance if you want something to read about it.
Well, I know in the past that for our webinar series, when there was something very interesting to our audience and had overwhelming response, we did add on a part 2.
Oh.
So if folks want to fill out the survey, we could definitely invite you back for a part 2 next year.
Okay. If people are interested. Well, I know you said about 80 something people registered, and it looks like 15 people are here. So I don't know. I'm not sure how much interest there is, but usually, if that's the case, I'd be happy to come back.
No, yeah. So, you know, we've had this webinar series maybe about more than 2 to 3 years now, and it's every second and fourth Friday of the month. And so now that people are used to us, they know that they're going to get a recording.
Yeah. that makes
So,
sense. That
yeah.
makes sense.
So we also do, for reporting, we also keep an eye on how many people watch the video.
Awesome. Well, I appreciate, like I said at the beginning, I appreciate everyone who's here today. You had lots of choices what to do with your day, and you came here to hang with us. So thank you for that. I see a question: would a death doula be able to help with issues that always come up regarding how to prepare both patient and ohana? Do you mean prepare like mentally and emotionally for death? Is that what you mean by that question? I don't know. I guess people can't unmute themselves in a webinar, huh?
I could, with their permission, because it's being recorded.
Oh, okay.
There's also another question about a student who is terminally ill and has been fighting cancer for years, but treatment is no longer working.
Mm-hmm.
She has had to move in with her father and stepmother. I'm not sure she knows about death doulas. I do think she's in hospice. How should I tell her about death doulas, or should I?
Ooh, well, should I guess is a question I can't really answer, not knowing how close you are to the person or how comfortable you feel talking about death with them. It's all about how you approach it. I wouldn't probably say, if I was approaching someone who's terminally ill, was like, oh, death duels exist. Like, did you hear about this? I would, kind of slide it in later after gauging, what's going on with them, like having a regular conversation about, hey, checking in, how are you doing? How normal is it for you to be talking to them on that level? Like we say student, I don't know if you're, their teacher, but if that's the case, like if you check in with them, asking how they're doing, checking on family, listening to them, letting them share emotion, letting them share grief about being sick. And if appropriate, definitely, you can just say like, how's your family doing? I heard of this service recently, and I'm wondering if you all could use an extra layer of support, or extra layer of care and help, and how that's going. I would never just just say it, mostly right up front, just gauge where they're at first. Oh, I'm mostly thinking about the disagreements. And keeping the patient's wishes respected. Ooh, oh man, how much time we got left? Well, this is why everybody should have an advanced healthcare directive. So everyone on this call, everybody, everybody over the age of 18. Don't wait until you're older. Don't wait until you're worried about illness. If you are over the age of 18, you should have an advanced healthcare directive on file. And the most important thing that it does, as you have a copy in your medical record, is names who your decision maker is in the event that you can't speak for yourself. Because legally, that person speaks for you. And the other people who try to chime in, go against patients' wishes, are selfish and are like, no, I want this, you can't have that. Like legally, they're not going to be listened to. So I think advanced healthcare directives are fantastic for many reasons, but one of the main reasons is it takes that suffering away from the patient. The worry, will my wishes be recognized? Will I have what I wanted, the care that I wanted? And then also takes the burden off of the people who they have chosen as their decision maker, because what they say goes. It's very common for people to disagree at the end of life, what happens with a loved one. For example, I mentioned in my story, my brother, who is doing much better now, but at the time my grandmother was dying, he was seriously deep in his drug use, and he never came around and he never helped. But when we were like, we're going to make grandma DNR because she's so sick, she would not want to be resuscitated, even though she didn't have an advanced healthcare directive. We just knew her well enough to know that's what she would have wanted. He was the one that was like, you can't kill grandma, like you can't do that to her. And honestly, oftentimes, from seeing so many families go through serious illness, it's often that family member who isn't around. who hasn't been helping, who feels guilt and shame around that is very vocal around, no, this, you can't do this, I want this. And that's very frustrating, of course, because they weren't helping, right? But there's always that cousin, that sister, that random person that lives 500 miles away that's like swoops in and wants to get their piece heard. And not saying what they think is just not important, but having someone's wishes in writing and having a legal decision maker in place takes that burden off of people fighting indefinitely.
That makes sense.
Helped.
Mahalo. Now, this is a question I'm interested about that someone posted.
Okay.
If someone wants water cremation, which is not legal yet in Hawaii,
Yeah.
are you able to arrange for their water cremation in a state that allows this?
That's a really good question that I honestly don't know how transport works in Hawaii in terms of cost and such. So just to answer what that is for folks who don't know, aquamation or water cremation is something that has recently become more popular. It is now legal in definitely California, I think Washington, I'm not sure how many states yet. It's not legal here yet. There was actually a bill that was in this session because I had a lot going on. I had a major surgery last month. I have not been paying attention to this ledge session at all, which I feel very guilty about, but I'm missing a lot of what's going on with bills. I do know one was introduced this session. I don't know where it went, but if it passes, aquamation will be legal here. What aquamation is using water and the pressure of the water to break down a body. And it's a more ecologically friendly alternative to cremation, because even though with cremation, you're not getting a burial vault and cement and all these things, and people think it's a more ecologically friendly option, the amount of energy that it takes to cremate a body and the pollution from it actually is not very friendly to the environment. Aquamation is much more friendly. So there's the push for doing that. And also it looks like it may be less expensive. So yeah, so hopefully it passes here. Also on that note, maybe you don't know, just so folks do know, that also body composting has become legal in the state of Washington, and there's at least 2 funeral homes there that your body will be composted, and that's very ecologically friendly. So to answer if it's, you can go to another state, I honestly, you'd have to look into what transport permits are like here. I know that my best friend's mom died in Ohio, and they paid to have her body transported in the cargo of a commercial airplane from Ohio to California. They got their correct permits. It costs thousands of dollars though, like probably $6,000, $7,000 in expenses she had in order to do it, to follow the letter of the law. So if you were interested in aquamation, that's absolutely the choice you want, I'd say look into it, look into what a transport permit would be like, but just know that might be the case. So, yeah.
Mahalo, that's a great question. Let's see, there's some other comments. So Oahu Cemetery is offering a traditional way of cremating body that preserves large bones. Mahalo nui loa for sharing your experience and wisdom, Leilani. Much appreciating your engaging presentation, thoughtful responses to our questions and advocacy. There's also a group who's offering classes at Manoa Heritage Center that one can wear a hala container. More mahalos. Oh, sorry, weave container. However, if this is urgent and the purpose is to preserve the long bones, there are 3 crematoriums here in Hawaii, 2 Oahu and Hawaii Island, that can take care of the ʻiwi.
Thank you for saying that, thank you for putting that in the chat. Absolutely. I apologize that I didn't ask if this was like an urgent matter, if it was, if you were just the person who asked about aquamation, if you were planning for the future, or it was something of a more urgent nature, since it's not legal here. If that is what your purpose was in asking, absolutely, that exists. And thank you, Kim, for putting that in the chat.
It is now 2:54. If anybody else has any questions or comments, and of course, she did provide her email address and contact information if you want to ask her privately on one-on-one. You can also contact myself, and I will make sure she gets that. And it's great having you. My middle name is Leilani, and you're Leilani, and so today is Leilani Day.
Hey.
So I just want to, the next presentation is April 22nd, and it's going to be featuring Keone Young and Dodie Rivera from Waianae Coast Comprehensive Health Center, and they're going to be discussing the houselessness in West Oahu. So if you want to register for that, you'll get that recording as well. And I just want to mahalo everyone for joining us, and mahalo Leilani for sharing your ʻike with us today. I'll keep in touch, everyone. Malama pono, ahui ho.